Yes, yes.
And then this will just kind of bring everything together. So
perfect.
It's not that I don't want you here. It's something about the way you stare into my eyes. I know that I don't make things clear. I fall for you.
Hey girl, hey. Okay, so I am getting ready to have a consult with my surgeon. So stay tuned. I thought that I would let you all listen, be a part of it, and listen to the questions that I ask. I'll also have them pop up on the screen once I edit the video. So let's see what your girl is getting ready to do next. Hey, Dr. Earle, how are you?
Hey, Felicia, how are you?
I am well. I am well. It's good to see you again.
Yes, good to see you.
Yeah, last time I was a little drowsy.
Oh, yeah. You coming back?
Yeah, I would love to come back. I'm just trying to see how beneficial it would be. I'm looking for Lipo 360. It seems like, I don't know if this is visceral, but it just seems like this kind of protrudes, like this upper part.
Kind of beneath the breast, overlying the ribs?
Yes. Is that normal, or is that something that can be corrected with lipo?
Yeah. No, I think it can certainly be improved with lipo. So typically over that area is not so much about the visceral fat, especially overlying the ribs. That fat does tend to be stubborn, very, very hard to work out or do anything else to it.
Mm-hmm.
It's a little bit more of a fibrous fat than the one like around the belly area. So, but yeah, certainly that's one of the areas that we would address with the Lipo 360.
Okay, and then I guess like we would go. I know you didn't do bra strap because that wasn't a part of the lipo with the procedure. But would that happen with the 360? Would we go higher up?
Yes.
Okay.
Yeah, so we would get into that whole kind of lateral breast area beneath the armpit,
Mm-hmm.
and then all along the back through there as well.
Okay. And then I don't know if you've noticed in the photos that I sent, but like, I don't know if it's a part of the breast part or if it's a part of my back. That seems like there's like an overlap.
Okay.
So if I look like right on this side, so I don't know if that's a part that would be lipoed also, or if that's coming into the breast.
No, I think we could. Yeah, we would lipo that area as well.
Okay. Okay.
So all that entire area.
Okay, perfect. And then, so I was letting your representative know about arm lipo. I know I don't want the scar. Like it seems like I'm a candidate for keloid because one side of my scar is pretty like flat, and then the other side it's still not flat. And I still use the gel on it, and I've been doing it for over a year now. So I just think that it may not do anything at this point. But I didn't want to have those scars on my arm, but I did want to get some of that fat off.
And do me a favor, when you hold up your arm like this, does that skin move around a lot underneath there?
Yeah.
Okay. So for the arms, probably the best option for you would be what's called the body type.
Mm-hmm.
Not sure if you've heard me talk about that, but so with body type, you automatically get some lipo. But on top of the lipo, you get the actual body type machine, which what it does is that it helps the skin retract, okay? So it uses a type of energy called radio frequency energy, and that energy kind of heats up the tissues, and it causes a certain degree of inflammation,
Mm-hmm.
and that helps the skin kind of contract and tighten up.
Okay.
And I think it's a very good good kind of solution. It's not going to be as aggressive as the arm lift. Okay, Okay, so it can't be that powerful, but it could certainly do at least, does at least 50% of what an arm lift could do.
Okay. Okay. So I would see some results from it.
Yeah, you'll see some results from it for sure, and there'll be no scar, like just a little tiny scar at the elbow where we go in. That's it.
And what is that downtown time like?
It wouldn't kind of change anything from the Lipo 360. So the only thing additional is that you're going to be wearing some sleeves.
Mm-hmm.
So you do have to wear compression there, but in the same way that you're wearing compression everywhere else, you have to use that for the first 6 weeks, basically 24/7, and then for an additional 6 weeks, 12 hours a day. So you get to about 3 months post-op.
Got you. Now I'm still getting lymphatic massages. Is it necessary? Like I get them every week.
At this point, you're a year out, so it's not completely necessary anymore.
Okay.
And also with the scar, like you said, there's probably little change now after a year.
Mm-hmm.
But I'll take a look at that area that you're saying when you come back, and potentially if we need to do a little scar revision or something at that time, we can do so.
Okay. Okay. So, and I'm still wearing faja boards and foam. Should I put them aside?
You don't necessarily need to do any of that anymore.
Okay.
So
I'm not. This is it. This is.
The foams and the boards, you don't need that. I've had some patients that like to just wear a little extra compression long term, during the day.
Mm-hmm.
But at night, for sure, you could take everything off, be comfortable. You don't need to be compressed at night.
Okay.
And if you don't want to, you don't necessarily need it during the day either. It's just depending on how you feel.
Gotcha. Okay. That's pretty much it. Like I definitely want to get it done. I just wanted to talk to you just to make sure that I was still a good candidate and that I would see those results. So I'm thankful for what you've already done. And I'm excited about what you can do, what more you can do. So.
Of course. Awesome. Yeah, no, I was just looking at your before and after right now, and I was like, wow, that's a big change for you.
Yes.
And then this will just kind of bring everything together. So
Perfect.
you're a great candidate. Okay.
Well, sounds good. I appreciate your time and you calling, and you're looking good. All right. Thank you so much, Dr. Earle. So I guess you're one of your reps contact me.
Let Claudia know everything we talked, and she'll probably reach out shortly. Okay.
Sounds good.
All right.
Thank you.
I'll see you here in the near future. All
you
right?
will. Thanks so much.
Take care.
Bye. Okay, so hopefully that recorded. That was Dr. AlexEarle. If you're not familiar, he is double board certified. If you go back and look at my videos about a year plus ago, I think I've talked about him, but I know I talked about him or maybe gave his background, but double board certified, never had a death. He's a plastic surgeon, and he's the GOAT. He is the GOAT. So I am looking to have Lipo 360 and something with these arms. So that's next on the ones and twos. Stay tuned.
I tried to resist, taking it away. Come chase beach views and every day. All I wanna hear